President of the Royal Australian College of General Practitioners, Dr. Nicole Higgins. Nicole, thanks for joining us. What do you make of this data from the Health Department? And are you worried about a potential landslide of 1 million doctors' visits a year from people seeking out vape prescriptions?
Yeah, good morning. It demonstrates the enormity of the problem that's been created. We've got a new generation of nicotine addicts when we know that 90% of our disposable vapes that have been coming into the country contain nicotine. We also know 9 out of 10 people see their GP every year, and this is part of what we do, which is smoking cessation and now helping people get off the vapes. And vaping prescriptions are just one tool in our toolkit to help people quit.
But with a GP shortage at the moment, can we handle it?
Yeah, so this, I guess the first thing is this is going to happen over time. It's not something that's going to happen immediately. And we also know that most people can access their GP within 1 to 2 days. And if we're going to get off nicotine, this is something that does need to be planned so that we can help taper. But we also have lots of other resources and options. We have Quitline, we have other nicotine replacement therapies such as patches and gum, etc., which are available over the counter. So, GPs are there ready to help their patients. All GPs can now prescribe nicotine replacement vapes, and it's going to happen over the next few months. So people do need to start thinking about how they're going to quit vaping.
And what do you think about this analysis that for young people, if you've got low bulk billing rates and it could push people to the black market, and also they could turn to tobacco as well? Are you concerned about that?
Now, the reality is that our bulk billing rate is still up around 80%, and GPs are accessible despite some of the commentary. And the other is that cigarettes, the pricing puts them out of the reach of a lot of our younger people. But we have lots of tools available, patches, gum, nicotine vapes that can be tapered down. But what we also need to remember that if we don't intervene now, we're going to have a future public health crisis and a new generation of nicotine addicts. So it is really important that we intervene, we plan, and we support people to get off vaping.
We know things like contraception. People can go now straight to the pharmacy to get these prescriptions and long-term prescriptions and things like that. With 450,000 more Australians expected to seek out prescriptions for nicotine vapes each year, should pharmacists be allowed to issue without a prescription?
Yeah, so that's already in the pipeline, and we know that we already have nicotine replacement therapy over the counter already. So what we need to make sure, though, is part of a comprehensive support program. Getting off nicotine's not easy, and as most people know who've tried, it's you actually have to do it over time with support and a lot of psychological support. That's why your GP is best placed. But we also need to make sure that nicotine replacement therapy is also widely available to support people to quit.
All right. Dr. Nicole Higgins, thanks so much for your time.